Hello everyone. It is, again, a great pleasure to always come and have a conversation with my friends, because I consider you all my friends, and a team, which is needed at this level. I would like to know if you can do a series on thyroid health. I have been diagnosed as a hypothyroid and am having major endocrine gland dysfunction due to my thyroid. I've had a prolonged bleeding of the uterus, which has resulted in iron anemia, etc. I have been told that this condition requires hormones, but I am unwilling to take hormones. Is it possible to restore the thyroid without hormones? Mia. Hey, sweetheart. Mia, you know what? This sounds not just thyroid. Thyroid doesn't control them all, but the pituitary does. And it sounds like you've got a pituitary problem here affecting menses too. That would be your pituitary causing this problem, Mia. So you'd have to look at that. I would be suggesting that the pituitary is the problem. Now, when you see glands or organs having a problem, what's up with that? I mean, what is an organ and gland made of in the first place? Cells, right? And what else? Two fluids? Absolutely. So you've got these two fluids, and you've got a bunch of cells. Now, when you have a bunch of cells, their health depends upon these two fluids, correct? All right. What's up with that? What do these cells require? Well, we know they require carbon and oxygen, number one. And then when you get into the world of nutrition, you're kind of into the worlds of theories and what you should have and shouldn't have. So you have a lot of chemists making a lot of isolate formulas, which is vitamin and mineral formulas. And we've just gotten off the beaten path that way. I think more aptly, detoxification is more the answer, because everybody's tried the nutritional side, load up on nutrition and everything, but it doesn't take, that's okay for the blood and getting nutrition to cells, but that's really the minor problem that people have, and a very easy one to correct, because all you have to do is shift your diet to at least predominantly raw, at least 70-80% raw. Pop yourself a super green drink or blend like our superfood blend, and you've got all the nutrition you're looking for. You don't have to study years of nutrition to know the calcium phosphorus balances, because they're changing. There is no such thing as static issues. Everything is always in flux. Chemistry is constantly in flux. So to make a statement that you need X amount of this, you need X amount of that, is bullcrap, in my opinion. And you just eat and be happy and enjoy the now, and your body will get very, very healthy. So Mia, if your thyroid is low, what makes a thyroid low? Well, obviously, it isn't the blood problem, right? Because when you see problems with thyroid, you see goiters, you see nodules. What system would goiters and nodules be a part of? Yep, the lymph system. And that lymph system is key. So when you're having problems up here, go get and detoxify your body and grab that lymph system. Now, you made a comment about the female side and excessive bleeding. Pituitary. And this pituitary does mess with all your other glands. So my suggestion is that your lymph system's backed up. If you have any sinus problems, things like that. When the sinus is gooped up, so is everything else in the head. The thyroid, the voice box, everybody gets congested, and it suppresses the the function of cells. Let's say that I took a normal breathing person, and I put a heavy blanket around them, and wrapped a heavy blanket around them, and I said, now breathe good. It'd be exceedingly difficult to get oxygen and to get health to that person so they'll sustain, because you've wrapped them with a blanket so they can't get air in. Well, what's a big thick wad of mucus do around cells? Well, after a while, a cell can't empty into the lymph system anymore, and now you have intracellular acidosis. That's the damaging side of that. Outside of that, it's just inflammation, because it's outside of a cell. And remember, the cell wall is full of HDL, and then you have the lymph fluids. So cholesterol is all there to help people. That's all set up as a system. So really, I would, and the same thing with the pituitary. Lymph. So it sounds to me like I'd focus on my pituitary and pick up that thyroid. You might also want to look at your skeletal system, see your fingernails, bruising, easy, varicose veins, spider veins, because this would be the parathyroid. And it is possible that the pituitary can impact the thyroid and not the parathyroid, of course. Anything's possible. In the strange and wacky world of hormones and steroids and the whole world of the body physiology, anything's possible, especially when you're looking at people that have been eating wrong for generations. But work that way, dear one, and see how that does me. Get on a detox, clean up your bowels, and remember, if you are having thyroid problems or pituitary problems, the chance that you're having transverse colon problems simultaneously is very high. So you always want to fix up the GI tract, get on the GI broom, get the kidneys and adrenals online, because you got to grab all the way up here and start cleaning this upper part of your body out, lymphatically speaking. And the fruits are going to be the best to do that, and the berries and the melons. Are there any herbs for hyperthyroid I may take and connective tissue? It's a good question. I think an important question out there, guys. So I want you to think about this. Anytime you have a hyperactive case, you don't want to give anything for it. Like if you have a hyperactive thyroid, you don't want to give anything more for the thyroid. The thyroid's already going, woohoo, I'm not having fun, leave me alone. Oh, more? All right. No, you have to detox because there's either inorganic iodine or iodine stuck in the thyroid or pituitary. There's some kind of chemical stimulating this, or just acidosis can stimulate hyperactivity, no question. In the end, it all ends up in hypo and then death, of course. And hyperactivity can be shared with hypoactivity. You can go back and forth, hyper-hypo. Just like your heart rate. Your heart rate can go tachycardia, which is fast, or bradycardia, which is low. And you can see brady-tachy and, hyper-hypo. You know when you see things like that these are stimulants. These are proteins, acids, chemicals that are creating this problem, whether in the central nervous system, in the pituitary, or in the thyroid itself. I wouldn't do anything. I would detox. And this holds true with goiters. Never treat a thyroid with a goiter problem because it isn't a thyroid problem. See what I'm saying? When you're looking at these problems, medical doctors will associate these problems with thyroid problems and remove thyroids and stuff. Goiters have nothing to do with thyroids in the sense that it isn't a thyroid problem. It's a lymphatic problem. Thank you. Big difference. The lymphatic problem becomes a thyroid problem. But if you go to causative factors first and realize a bunch of cells and two fluids, swelling, is that a cell or is that a fluid? Fluid. And then what kind of fluid would create swelling? Blood? Nah, base chemistry. Lymph, acid chemistry, edema, swelling, acidosis, absolutely. In terms of connective tissue, parathyroid. And it's possible to have a hyperthyroid and a hypoparathyroid. That's why I like glandulars that are, let's say, parathyroid induced. If I knew some strong herbs for the parathyroid and stuff like that, we would definitely move in that direction. So you want to always make healthy the endocrine glands, as we've talked about. You get the kidneys filtering. That's why these charts are so important. Because when a medical doctor sees that, they think you have infection. 180 degrees different thinking. The kidneys filters the lymph system. Remember that. Right side, right kidney, left side, left kidney. So bye-bye right hip, bye-bye right kidney. So this is why you need to get the kidneys and the adrenals up and get this filtration. You can use the glandulars to inspire. I would much rather see medical doctors get involved in glandulars instead of getting people stuck on hormones and steroids. Because we know the fatal issue that brings, the continual shutdown. And then, of course, the thyroid produces calcitonin, and you're not on that. And then, is it a TSH problem? Is it a pituitary problem affecting the thyroid? So work with the gland tonic that we have. You can work with the thyroid tinctures, or you can get thyroid glandulars. That's better to work with that and get that thyroid up and get away from these hormones. At the same time, fix your body, get these cells healthy, because he's got some problems here. Sinus issues, well, that gives you a thought of maybe pituitary influence on the thyroid, because when your sinus is backed up, what is impacted? Pineal gland. Pituitary, well, she can't sleep. Pineal gland. And you can use a glandular, but at the same time, you want to detox. She's got forgetfulness. She's starting to move toward dementia and Alzheimer's. So when you start moving in these directions, you know what's causing this. Is this a disease affecting me? Oh, it affects all the older people. It's all based on acidosis and your inability or ability to move lymph and to keep inflammation, which is simply acidosis, out of these tissues. Had tonsils out as a child, so it shows you automatically when you have your tonsils out, your lymphatic system's backed up, and she's been backed up since she was a child. But in all fairness, most people put you on formulas or milk. A blood specialist has encouraged you to eat red meat for iron levels. Metabolize iron. Get your iron from your foods and metabolize iron. If you have to do some green drinks of parsley, dandelion greens, spinach. Yes, it requires a changing of attitude and viewpoint. But you must, guys, you must do that. For those that are new, you must change your viewpoint on health and wellness. Get excited about a diet of fruits, berries, and melons, because that's where all your flavors are. If your kitchen is full, like mine, of fruits, berries, and melons and vegetables, the smell is incredible. That's where your good smell and taste comes from. I have to say, I like a big juicy salad. And I like how it tastes. Although the greens, I rarely use on salads. I like all my tasting, my carrots, my cucumbers, my avocados, my tomatoes. I love all that. My peppers, I love all that. This is Rena. Hi, Dr. Morse. I have a question about hypothyroid issues. I have estrogen dominance, so I seem to be very hypothyroid. I don't know why that would matter, sweetheart. My oral temperatures in the morning is 96. Ooh, oral, huh? Well, if your basals are a degree less than that, that's pretty cold. By night, it will go up to 96.9, 97. That's oral, though. My resting pulse is somewhere between 65 and 70. I should also note that I have been a runner for many years, so I understand its effect on my adrenals. In correspondence to this, I have not had my period for about 2 years. It has never been regular. So let's stop right there. And let's go tie that monthly cycle problem back to estrogen dominance. Now, we can blame the ovaries. And it's true that the lymph system backs up in the ovaries, can suppress estrogen, progesterone, it can do that. But I think when you see the monthly cycles irregular and the estrogen dominance, I think safely, and with the thyroid down, I can safely go right up here to your pituitary, dear. And remember, we talk about the pituitary as the controller of FSH, that's follicle stimulating hormone, that's ovarian. And then you got your TSH, which is thyroid stimulating hormone, your PTH, parathyroid stimulating hormone. These all come out of the pituitary. So it sounds like here you have a pituitary issue going on, sweetheart. If you do, then you know it's tied to your colon here, and who knows what's going on in the sinuses and everything. It could really be backed up there. Clean your sinuses, get your bowels cleaned up so the sinuses can drain, get your kidneys and adrenals on. But I would use a glandular for the pituitary there, but wouldn't go overboard with that. Maybe a New Zealand glandular for the pituitary, 1-3 times a day, 1 bottle, and see how that does. Or if you want to go slower, then get on the female reproductive, which will reach up and touch the pituitary. I'd probably get on the female reproductive anyway, but I would definitely look at that pituitary because it could be suppressing the thyroid. You could have a thyroid weakness on top of that even. So that's where your eyes would come in, take a look and see your eyes and see if you have a thyroid. If I was going to go after that and didn't know, I'd probably do the pituitary for a month, glandular, with the adrenal glandular, and then I would come off the pituitary and go on a thyroid glandular and a parathyroid glandular for a month. And then stop and reevaluate. Check your basal temperatures under your arms. Don't do your oral. See where you're at. This whole thing is about cure. And I'll use that word because not curing from disease, but curing as a way of finding your remedy. In other words, making the tissue healthy again. So it takes you back to understanding what 2 things affect the health of a cell, or the vitality of a cell, or the functionability, what I call, of a cell. And that, of course, goes into its genetic memories. It's mind. Just like your mind affects your functionability, is what suppresses cells in the first place. Even genetically, what initially starts the downward slide of cell functions? Well, you do have trauma, so let's exclude that as a possibility, but it is a possibility of trauma, injury, and let's go right to most causative factors. That's acids in the lymph system. Because if not, you're on the blood side and the base side. Well, that's not what hurts people. If your blood hurts you, like I said, you wouldn't be alive long enough to feel it too long, maybe 3-4 minutes. So the thyroid, the glandulars are just to empower the cells to wake up from its genetic slumber. And then as you begin to move that lymph, you start to empower that tissue and get those tissues healthy by cleaning the lymph, getting good nutrition, and you're good. Everybody's good. Thyroid's whole. Everybody's good. It is the rebuilding or regeneration of the tissue, which is the cells. Well, this is where I get into the glandulars. You're already walking down that road anyway. Depending on how low the thyroid is, you would use a thyroid glandular. And what you would do is, glandulars are, of course, the desiccated tissue. It's not the hormone of the tissue. There's no hormones or steroids in glandulars. Their idea is to excite the whole gland. So I would use a thyroid glandular. Now, you want to correlate that, Patty, with female menses. Did you start young? Did you have irregular periods? Look and see if you can pick any other pituitary possibilities. Vitiligo and shoot, I mean, there's all kinds of things, I suppose. If you're having colon problems in any way, the possibility or probability of having a pituitary problem is up there. So you would want to maybe go that way. Look and see if you have parathyroid weaknesses with it. They're both going to yield you connective tissue weaknesses, which is prolapsing, wrinkled, saggy skins, breasts, prolapsing uteruses, bladders, bowels, things like that, depressions, petechia, bruising easy, varicose veins, spider veins, hemorrhoids. If you see too many of those things, you definitely can go to the parathyroid. And if you see both the thyroid and parathyroid, then it is more possible to have a pituitary. If you have female issues, conclusive, I would hit the pituitary with a glandular and let that. At the same time, you can start titrating, meaning coming off of these pharmaceuticals, especially synthetics, knowing that the longer you're on them, the weaker the gland would be, and you might want to introduce your MD to glandulars. Medical doctors should use glandulars. It fits in their glove pretty good. There's no reason for them to be antagonistic because it's got physics behind it and a lot of chemistry behind the use of them and a lot of years. You try a pituitary glandular, a thyroid glandular, and it didn't seem to have that you needed, then it probably is the pituitary. And this would also be true if they can't regulate this with synthetic T4 and T3. Knowing the pituitary is the problem, would be a TSH problem. And even though they're looking at T3s and T4s, a lot of blame gets on them when it's a TSH problem. And again, I'm just saying that understanding those, you can find the right glandular and use that to pop that. At the same time you're correcting the Y, then after a while it'll all hold and you don't need to take anything. And that's the whole goal of wellness, is that we're supposed to just live off the earth, have the type of foods our body's designed to eat, right? Can I take something for a hyperthyroid to put some weight on me? Now, I felt this was a real important question. No, do not, because hyperthyroid, you got to correct that problem. Correcting hyper cases is easier than correcting hypo cases. Hyperactivity of a tissue can be spawned by simple acidosis, different chemicals like iodine in the thyroid, or that's about the two main things, really. Going back, though, to the thyroid, if you go a little further up, you can actually have stimulation of the pituitary from the same reasons, then reflecting back and overstimulating the pituitary. The other place you could have problems is the gut, where you have a lot of spasticity, and that reflecting back up to the pituitary or the thyroid and having that reflex bound. That's why, believe this or not, this is why detoxification is a good answer for everything, because in all cases you must clean the body out of either tumors, acids, heavy metals, excitotoxins, neurotoxins. Proteins are the biggest culprit. All these things have to be cleaned out of the human body to be well. Acne. Immediately you know she's not filtering from the kidneys. The skin is putting up the work. So she's backed up subcutaneously. Well, here's a hypothyroid, meaning it's low thyroid, meaning that you don't get enough body temperature a lot of times to sweat. And if you don't open the skin door, the third kidney door, then just below the skin in the what they call the subcutaneous level, you start to see that backing up. So now you start to see the skin breaking down with the acids because they're not filtering, they're just hanging around burning you. And then you get the skin, the acne, the psoriasis. It don't matter what level. These are all just different levels. It doesn't matter a rash, a boil, a pimple, red little things popping up. It doesn't matter. It doesn't matter. All right, so there's the emotional swings. Well, here's the adrenals. All right, now if the pituitary is involved here, the pituitary can actually make the adrenals swing too. So we have a pituitary making everything swing. Now, if it's affecting her parathyroid as well, she could run into a little depression, especially after she has the kids. She can start seeing some wrinkles, she can sagging skins, the bruising easies, the varicose veins, spider gains, the fingernails, blah, 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 blah. Here's the thyroid, here's the pituitary, so she's got lymphatic problems. Now, here's the problem. If she has weak adrenals and she gets inflammation backing up the neck and backing up here in the cerebellum, that can flip her into an MS type of scenario. So you see, these are the things we build and we create. So now we have to unbuild and uncreate here. Her thyroid is down, probably her parathyroid a little bit, her pituitary's down, her periods are out of balance. So there's where you see it. But how do you pull something like that in balance? Simple. You start cleaning, getting the bowels cleaned up, get the kidneys filtered, get the adrenals up, go into that pituitary, get that up a little bit, see if that's enough to perk up the thyroid, then go after the thyroid a little bit, check your basal temperatures, watch the journey as you go along. Start working on your case. Not difficult, but you start the raw because you're going to start enhancing, you're going to start hydrating, you're going to start cleaning. So you're going into the raw, you're going up into the fruits and berries because they're the cleansers, they're the healers, they're the detoxifiers. Upper circ, brain and nerve, upper circ, brain and nerve, upper circ, brain and nerve, fix the thyroid. It's well known in hypothyroidism you lose your hair. But I think it's from the same acids that make for hypothyroidism. I don't think the thyroid has anything to do with hair. Your body's going to dump whatever it doesn't want, from teeth to hair to fingernails. I'm telling you, if you go too fast, you can even dump your teeth, or your body tries to. But you can fix all of that, and the smart detoxifier knows how to strengthen while things loosen. But you've got to detox. That's the key doorway to getting through this wilderness of symptoms and unhappiness and pain and all of that. Because when you see a hemorrhage or you see a petechia, a bruising easy, when you see a weakness that wants to aneurize or herniate, swell, give forth, break loose, then you know you're losing connective tissue integrity. So the first thing you're going to think about is parathyroid gland. Because let's take a look at this. We use the word autoimmune, but let's take a look at this realistically. This is all based upon what? Chemistry. This is all based upon chemistry. Everything is. This man had to be very acidic in these tissues to lose the integrity of the connective tissue, so it allowed him to herniate those alveoli. Wherever it is, it can be, herniation can be anywhere. You know, we have people that bruise easy all the time. We have people that have aneurysms all the time, hernias, and all this is a sign of connective tissue weakness, which takes place in an acidic medium. Why? Because bone matrix is high calcium and phosphorus, particularly calcium, and that is a great place where we can borrow calcium to fight acidosis. So we end up, and it didn't mention any calcifications in the lungs, but it's enough to say that you're looking at either a parathyroid weakness in this body of this man, particularly if he had herniation in the adrenal glands. You don't want isolate of iodine. I don't care if it's from kelp or where it's from, it's still an isolate. And any isolated chemistry will unbalance body chemistry. It has the potential, obviously, to become a free radical, which is what iodine does as an isolate. And nothing ever good. A lot of hyperthyroids came out of iodine usage. Everybody's different in that. Some people are just full of mucus in the head. So down goes the pituitary, down goes the pineal gland. The thyroid gets full of mucus, and then you get polyps in it. And then some people get goiters from it. You know, you just start seeing this lymphatic expression of swelling and tumors and inflammation or acidosis. So that's always the system to work on no matter what. And how hard it is, you know what? It is hard. You're talking about miles of interstitial realms around all the cells head to toe. And it's just going to take you a while to hydrate and get this moving. And don't freak out. Just make life better for yourself. Also, there are any relation to thyroid issues and bananas. Also broccoli. I mean, you hear this crap constantly. I say blame your meats, your dairies, your grains, and your beans. My family told me that our iridologist mentioned that bananas either contribute or were a no-no for me as I have a goiter. Whew, I need a drink. Long Island iced tea, I hope. Nope. And here's an iridologist saying crap like that. If you have a goiter, what is a goiter? Tumor. I haven't seen a goiter yet I couldn't get out of a person. She was diagnosed with hypothyroidism when I was 12, and she's 22. She was diagnosed with polycystic ovarian failure. Basically, she has little tumors or cysts on the ovaries. Now, what system does cysts and tumors develop from? The lymph system. We could say pretty much the interstitial fluid, the fluid that flows around all the cells, is basically what most tumors and cysts are made of. Premature menopause. Well, looky here, premature menopause. The controlling of menopause is controlled by the pituitary and the ovaries, of course. Pituitary controlling the ovaries. So here we see a little thyroid up here. We see an ovarian failure here. So we could link this to one's pituitary gland. You know the polycystic problem is a lymphatic problem which goes right back to the kidneys and the adrenal glands again, and the failure to filter the lymph system appropriately. But when you get into the premature menopause and the hypothyroidism, that's an endocrine gland issues. We're going probably up to the pituitary here, my guess is. I quit taking medicines and went raw in February. Good deal. This blood work shows normal thyroid levels. Good deal. Blood work, though, is very inaccurate in determining thyroid levels and stuff. Do your basal temperatures under your arm. Like one gentleman wrote in, his was 95. Horrible. But check your basal temperatures under your arm before you get out of bed in the morning. They should be, in today's world, give me 97.5, but 97.8 is considered low normal, 98.2 high end normal. But reality is, in today's world, mid-97s, you know, that would be good. The iron levels are low. There's the adrenals again. Hematocrit is low. Again, by cleaning up your body, cleaning up the liver, cleaning up the spleen, cleaning up the kidneys, and moving the lymph, getting the adrenals up, you'll change the morphology of your blood cells. And this is true in sickle cell anemia. This is true in all these types of irregular red blood cell issues where iron doesn't carry well. You know, eating an enzymatic-rich diet helps to break up the blood cells from clustering or following each other like choo-choo trains. You know, all these things come and change all this around. In a hyperthyroid case, I really never do touch the thyroid for a while, and I've commented this on other videos because and this is particularly true in a goiter situation where I'm dealing with a goiter. I don't really try to pick up thyroid function in that I'm picking up waste and going to increase goiter size. In other words, in anything hyperthyroid, anything hyper simply means there's something inspiring hyperactivity. Could be a chemical, could be acids. Any of these things could hyperstimulate the performance of cells. Acidosis can hyperstimulate and then eventually go down. So just inflammation, just that act can hyperstimulate or spasm things. Any heavy metals, chemicals, things like this can hyperstimulate the function. Iodine can hyperstimulate the function of the thyroid. You can get iodine, inorganic iodine, from many sources. So there's many dyes and things that people subject themselves to, that consume foods with dyes, and these can hyperstimulate the function of endocrine glands. The only true remedy to a hyper case, detoxification. that golden key again that unlocks that magic door to wellness and health and vitality. And it's the same with hyperactivity. Thyroidectomy, the guy ought to lose his license right off for being stupid. You don't take people's thyroids out. And then, of course, now here's another clue, guys. Listen to this. She is low in calcium, so do we have a little parathyroid problem with the thyroid? Absolutely. She could have basically hyperthyroidism and have hypoparathyroidism, and it all be coming from the pituitary. So you just clean the body out and go at the body, get the body healthy, go after the colon, because you know that relationship we've talked about between the transverse bowel and the pituitary. So you just go after health of the body in a hyper state, because if you pick up a gland, if you said, I'm going to go after that pituitary, you could really hyperstimulate that thyroid. Better just to detoxify first. That hyperactivity will go down to normal and everybody's good. Then you can work on the weakness. But get all that, any metals, any chemistry in there that's hyperstimulating tissue, that's a detoxification. Hypothyroid, get yourself a thyroid glandular like thyroid cytotrophin, kick that baby up. But something's suppressing it. And that's either a genetic weakness where the cells came in because someone in your family tree had maybe a goiter, a lot of lymph problems, weakened their thyroid, and now your thyroid cells came through it thinking they're not very good either. But as you waken them up with the magnetic consciousness of raw foods and the herbs, everybody's going to wake up to their higher ability. In other words, you're going to wake up that sleeping cells of the thyroid, but it could even be your pituitary that's suppressing the thyroid. Someone told me about, they're on Synthroid. This is when you use a glandular. When you take a hormone like Synthroid, which is synthetic T4, or people are on Armour. Dr. Jensen even put himself on Armour and his wife. And when he first came to me with his wife, it's like, guys, you can't be on Armour. It's making your thyroids weaker. And that was famous Dr. Jensen. But you know, sometimes we get trapped in things, you know. But Synthroid, you've got to use a glandular, which is a desiccated thyroid gland. Think a stem cell type of thinking. This enhances the whole thyroid gland, and therefore it'll make its own T4. Get that body opened up and get it in sweating. If you're cold and not sweating, pick your thyroid up. When you're cold, that's thyroid. Pick that up with a glandular or an herbal formula for the thyroid. Get your thyroid up, your body temperature go up, your ability to sweat will go up. Get you a sweat lodge. Again, I don't recommend infrared saunas. I recommend steam saunas. So you know immediately that if you have thyroiditis, that you have inflammation in the thyroid. Well, inflammation, what's the other word for inflammation? The more appropriate word. Acidosis. We know when you have acidosis, you're going to have an inflammatory response because that's nature. That's a natural thing of that because the body's trying to remove the problem. The problem is it becomes systemic when the kidneys can't filter anymore. So you know when your lymph system's backed up in the thyroid to give you inflammation in the thyroid, it's all backed up through your brain, Dennis, and everywhere else. So you're going to get brain fog. You can also get, honey, where'd I park the car? So this is the sort of thing is you want to detox, clean the head, the sinuses, and everything else. This can go much deeper than just a little thyroid inflammation. And it doesn't matter what your antibodies are, that all comes out. They go crazy with that kind of stuff, but that all comes out. The trouble with medical doctors in diagnosing hypothyroid, they got to attach a name to it, either Hashimoto's or something. They got to attach a name to things. And then, of course, people then are locked up into this ridiculous concept of diseases and blah, 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 blah. When really, think about this. You get mucus from different foods, proteins, more dairy, right? You get it in your sinuses. You get it in your voice box. You get mucus in your bronchi. You get mucus in your lungs. Why would you not get mucus in the thyroid and parathyroids? You do. And so that's the thing. You get full of mucus and lymph stagnation. And then you get acidosis. Remember, thyroiditis. Itis is inflammation. Inflammation is what? Acidosis. And acidosis, where's these acids coming from? Oh, the cells in the thyroid themselves. Oh, yeah. Well, that means in the lymph system around or in the thyroid around the cells interstitially isn't being drained through the kidneys, right? That's what that means. Now, it could be a pituitary problem too, where the sinuses are full of mucus. The pituitary is either genetically or full of lymph the same way, not draining out the head. It kind of relates to being foggy and things like that. That's not a thyroid weakness. Thyroid deals with heart rate, somewhat energetics, but more related to digestive metabolism. It's the thyroid controls your rate of metabolism. Now, the thyroid also produces calcitonin. So calcitonin and parathormone both are used in the utilization and the movement of calcium in the body. So there's a big deal to have a healthy thyroid and parathyroid. So if you're going to detox to fix this, then you got to really get in and detox. Could take you several months. If you want to use a glandular, which is what I would do just to enhance the function of, but you still have to clean the inflammation out of it. You know, the glandulars that is not a detoxifying issue. Glandulars are enhancing issues. They enhance cell function by stimulating cell awareness. I need protein. Yeah, no you don't. You need adrenal power to come up. You need neurotransmitters, because if you're feeling tired and foggy, my friend, you're losing your adrenals. Well, that's where the energy is. So you're probably running a little low blood pressure. So get on your adrenals and kidneys. That's your doorway into the lymph system that's backed up here and causing inflammation. The need is to get the adrenals up for the energy and the neurotransmitters. The protein will just bring you down more, bro. Too acidic, that's our problem anyway. Breaking down kidney tissue, GI tract tissue, got to lose the protein concepts. They've been wrong concepts and they've hurt man big time. Hypothyroid, get yourself a thyroid glandular like thyroid cytotrophin, kick that baby up. How can I shrink my goiter? The doctors say my thyroid function is normal, but I have a goiter. What herbs can I take to shrink goiter? I have thyroid nodule, and I have a biopsy, and it was benign. The doctor wants to remove the thyroid, but I don't want it to have it removed. I work out every day, and I can't see to lose weight. Please help. All right, sweetheart. First of all, I see you in this. If this is you in this picture, first of all, there's your adrenals. You got to work on your adrenals and kidneys. Stay away from starch. Take Parasite M so you don't crave it enough to get the fungus down in you and help that. You have, with the thyroid a little bit, do your basal temperatures under your arms and let's see what they are. Check both arms through the period of about a week. See what your basal temperatures under your arm is before you get out of bed in the morning. Just take a thermometer by the bedside and then put it under a bare arm before you get out of bed. Just check it. A couple mornings, play with each arm, make note which arm and stuff. However, goiters are easy to understand. And if you consider a goiter a formation of a tumor, you got a nodule, same thing. What fluid, what could be happening that could create a goiter or could create a nodule or create a tumor or create a cyst or a boil or a pimple or an what is all of these? Where's this coming from? Well, again, your body's only a bunch of cells and two major fluids. Pick one. You're going to be 50% right. So you know this is the lymph system. This goiter's more serious than the weight. You get your weight down, you got to do as much raw as possible. If you need to have some cooked, go ahead, honey, but really put your feet on the path and get going the best you can. You can eat as much as you want. The beauty of raw is you can eat as much as you want, as often as you want. That's the beauty of that, sweetheart. So get on there, move those lymphs. You get that goiter out of there, because removing the thyroid is typical child consciousness of the AMA. You've got lymph backed up. Removing the thyroid does not remove the lymph backed up, and it's going to continue to back up into the head, more throat problems. There's no answer in removing tissue. Fix tissue, and then there's nothing wrong with the thyroid. This is a fluid problem, not a thyroid problem. This is a fluid problem. This is more, if you had to blame anybody, blame your kidneys and adrenals, sweethearts, while you fight the weight more than anything else. Get this goiter out of there. Get rid of the dairies. Get rid of the grains. Grains for you, not a good sign. It's a concrete brick on your head. Any potatoes, get rid of the potatoes. Go as much raw as you can. If you have to have some warm foods, get your steamed vegetables, stir-fried vegetables, maybe a baked sweet potato, something to keep you doing this. And particularly do that at night, where your adrenals are going to give you your emotional run at night. And so you've got mucus in the thyroid gland. How do you fix a thyroid? You clean it. But Can we aspire to function a little better without totally getting it clean? Absolutely. Glandulars. Really fast way to pull up the thyroid gland. It is animal-based. If you don't want to do that, then you get, that's okay, honey, then you get into the herbs that turn out. Now, what herbs particularly are good for the glands? Anybody get an overview on that? The berries. All the berries. All the berries. And remember how they used to say each berry looks like the gland it controls, it fixes? Wow. Saw palmetto, excellent for the thyroid. Saw palmetto. Now, what if this is really not the class to get heavy into that, but remember the pituitary gland and the TSH, thyroid stimulating hormone. If it's low, the person's short. You know, we're going to be looking at the pituitary. You're not going to hit these things very hard. These are not like hormones or steroids. We don't use that component of life. But we don't want to use that component in life because we see what the medical doctors learned and still haven't changed. If you're hyper, maybe not a glandular, because if you hyperstimulate yourself even more, that would be more problematic. In a hyper state, the only true remedy is detoxification. The same thing with a goiter. I never touch the thyroid in a goiter. Even if it's hyper and now hypo, I still don't touch it. The more activity of cells, the more cell waste, the bigger the tumor's going to grow, because the problem is you're not moving lymph. And when you're not moving lymph, to produce more waste would make lymph even worse. So that's why you don't have a lot of activity when you have tumors and things, because a lot of activity is just going to make your tumors grow. You can't move lymph by activity when your doors are closed. And the doors, of course, is the kidneys and adrenal glands. I'm borderline hypothyroid, took sea kelp with iodine tincture. People go nuts with iodine tincture, and then suddenly you get hyperthyroid. And this is a never isolate chemistry, and iodine is one you never isolate. Your heartbeat sped up too fast, you don't touch your thyroid, because what you're saying, everything you do makes your thyroid speed up, your heart palpitate. You tried Armour, did the same thing. For some reason, it sounds like you're more hyperthyroid than hypo here. You take a little bit of iodine, you take a little bit of synthroid, T4, and you just, even T3 here, and it hypes you up. So that's what it does, is turn on heart rate. So I would lay low on that. I wouldn't touch anything. Do your basal temperatures under your arms. See what your basal temperatures are, honey, and see if you're anything below 97.5. I'll take a 97.5 in today's world of thyroids. But anything close to the 96s, upper 96s, are going to be real hypo. But this indication to me, and what you're saying here, is you're a little right on the border of being hyperthyroid, and this is throwing you out. See, you can't go by blood work. You can't. Are you cold? Are you hot? Are you warm? Where are you in body temperature? That'll give you some clue. The colder you are, the more hypo you are. The hotter you are, the more hyper you tend to be. But I would be real careful with doing anything with the thyroid gland here at all. You could be hypo, have a heck of a lymphatic stagnation here, and that's the trigger. But I would detoxify myself and really go after this, and go after the GI tract, right? Because I follow what you're saying here, and all your different things. And I would go after my GI tract, I'd go after my kidneys and adrenals, and after my lymphatic system. She also has hypothyroidism. When you have a gland not working, or that is hypo, meaning underactive, you really want to get into the glandulars. This is the benefit of those glandulars. Use a glandular for the thyroid, and we have several, but use a glandular for the thyroid to bring the whole thyroid up, because the thyroid doesn't just produce T4, it produces calcitonin. So the thyroid has to be, the function has to be increased, the cell's function. This is about the cell and the health of a cell. So when you say thyroid, what's the thyroid gland? Bunch of cells. No matter what that cell does specifically, no matter what it produces, Just think the cell, the health of the cell. What does the cell need to be healthy? The same thing a little baby does. It needs to be fed, so we can argue nutrition, okay? But then it needs to be clean. You got to clean those diapers or you start burning the baby's little bottom. And this is exactly what you have to do at the cellular level. And when you do that, now you can return the health of the cell, because when you're adding nutrition, you're adding so much, especially with the raw foods. It's not just nutrition, it's magnetic consciousness, it's magnetic intelligence, it's energy. If I empower those cells with energy, it's going to wake that body right up, and then soul can stay in it. You wrote that you had Hashimoto's, hypothyroidism, and you have vitiligo. Well, I suggest that your thyroid problem, in just these two things that you're fighting here, sweetheart, is pituitary. Pituitary is the skin pigmentation, and also it controls the thyroid. So before I would separate those two, I would definitely get in a glandular for the pituitary gland. Work on my bowels, because I can tell you, most of the time, and I've mentioned this on other videos, that most of the time when we see sinus and head and pituitary, we see colon. And the wheat products and the grains, they destroy the bowels. There's no question about it. And so you'll want to work on your GI tract, and you'll want to work on your pituitary gland, probably take a pituitary glandular. That'll help quicker. That should turn on your thyroid. If you have a thyroid that's weak specifically, then you can get into the thyroid tincture of herbs, or you can get into a thyroid glandular, but the pituitary is going to control the thyroid. And both of those, my suggestion, are probably linked with you. But yeah, go into that body and clean it out. Hit your GI tract there, and get yourself cleaned up there, get the thyroid up there, and, excuse me, and get away from these grains. It'd be very important for your health to do that. One case I was looking at this morning, writing her up a protocol. She's on 2 thyroid medications. She's on Armour, which is natural T3, and her T3 is too high. He also has her on a synthetic T4, and trying to pump her thyroid. And if you look at her blood work, the thing that's off is TSH. She's low TSH. Well, that's thyroid stimulating hormone. You can't make the thyroid make more TSH, because the thyroid doesn't make TSH at all. It's the pituitary that makes TSH, and this is why this medical doctor is not able to help her. He's hitting the wrong glands. He needs to hit the pituitary. But then the way he does it, he doesn't understand glandulars. So this lady needs to be pituitary. So I had to change her, work her up a protocol and show her what she's doing wrong. And her medical doctor just doesn't understand. They equate TSH always with the thyroid. It's thyroid stimulating hormone, but produced by the pituitary. Problems in her pituitary. When you're hitting your glands and they're not turning on, you go to the higher, you go to the CEO, you go to the boss. Thanks so much for advice for someone with half a thyroid. Any advice for someone with half a thyroid? If I foolishly had them take out the other half because of a nodule. Oh. So what was that nodule telling you? What's a nodule? Like a little tumor, isn't it? So what system did that tumor come out of? Interstitial, right? It had to. It's only thyroid is just a bunch of cells with 2 major fluids. So when you see an expression, when you see a swelling, when you see a pocket, where's that pocket coming out of? Exactly. It's coming out of that interstitial fluid. It's coming out of that tissue. And that pocket is holding interstitial fluids. And so this is when your lymph system doesn't filter well, doesn't move well in the body, then you start to see it backing up, like any sewer system would, just like any place would. And this is the problem. So now you haven't fixed the problem. Of course, you didn't know any better, so don't beat yourself up. See if you can get this thyroid to grow back. You still got enough there, so see if this thyroid will grow back. At the same time, you've got to get yourself up there. If you want tissue to grow back that you've removed, especially when there's some left like that, we've seen that, then you want to get high up. You can't regenerate tissue on dead foods, rotten meat, some kind of plastic milk stuff. You can't regenerate nothing on there. And sure would like to make you think that, how the little bottle of crap holds around these fruits and vegetables. I mean, that's false advertising, and that's wrong. That makes people have a wrong idea about what that stuff is. And so you've got to get healthy. And you can only do it on raw foods in terms of reality here. And if you want to grow back tissue, you know you got to be raw. You got to be up there higher, maybe even on the fruit line. That's when I see new neural pathways developing. New neural pathways. How cool is that? He took an iodine protocol, so his thyroid has been better. Well, that's the problem. Iodine is a stimulant to the thyroid. Wrong way of doing it. But that's what you're going to see. All these people taking iodine for this Japan's accident with the radiation there. Wrong way of protecting the body. Create a lot of hyperthyroidisms, and then we'll just keep cutting out people's thyroids. I mean, it's just amazing. Basically, I have a nodule on the right side of my thyroid. Now, this is common. This is common as the sun coming up. People have nodules in their thyroids all the time, and they can spend a lifetime with them in there with no problems whatsoever. For me, I'm one of those lymphatic thinkers. We got to get the lymph moving and get this nodule out of there. Whenever you see a nodule, you see a polyp, you see a cyst, you see a tumor, you automatically know that it's going to be filled with interstitial fluid. Since that's the only real fluid that's available everywhere, you're going to see it full of interstitial fluid, which is blood and lymph. More lymph, generally speaking, than blood, of course, but some of these tumors, you see the blood aspects of that. And it's just when you're not filtering properly. This is common in the thyroid, particularly without tonsils, of course, but it's very much so, giving you an indication that there is some GI tract problems as well. I have a nodule on the right side of my thyroid that was biopsied a few weeks. Last fall I was told that the cells were benign, but now the surgeon is saying we need another biopsy to see if the cells have differentiated and that they will recommend removing my thyroid if the cells are cancerous. You know, this is going back to this whole stupidity. If you have a cancer cell, remove the tissue. Well, what do you think your immune cells are there for and your lymphatic system's there for? And that's what they don't get. So then they remove the guy's thyroid, and then the rest of his life is pure hell. I did a 10-day watermelon fast and had amazing results. Good deal, but have not been good in terms of consuming 100% fruit since you recommend formulas for me to dissolve this nodule. Or can you? I have a lot of right-sided issues, so then you know your kidneys and adrenals are right-sided there, man, including the nodule and the long history of right-sided scapula and neck pain. Thank you. Listen, that's all lymph. All that pain and stiffness, even the frozen shoulders. I mean, that just shows you that this whole right side isn't filtering through that right kidney. Now, you can't do anything about right side over left side, but at least you're aware that this is the side that and the kidney that you're having trouble with. Just go after your kidneys. You would go after your GI tract to get, to open up this trunk of the tree. So if it was me, I would do stomach and bowel, whichever one, you need. Generally speaking, 1 or 2 is mostly what people use. I do the lymphatic 1 capsules if it was me, because it'll start pulling the bowel wall clean and all that. But you want to, do a liquid lymph like lymph node 2 and really start pulling on that lymph. Do the GI broom, make sure those kidneys are working on filtering, get your adrenals up. Adrenal cytotrophin or glandular or adrenal formula or endocrine gland formula, I don't care. But going that way and start moving lymph, I definitely would revisit the watermelon fast and would revisit a high fruit detox while you're doing this. I mean, make it all work for you. While you're doing the and spending the money on the herbs, do the time on the raw and really start pulling that out of there, and then you'll be good to go. But you never have thyroids kill, especially any gland. That gland is vital. And for anybody to kill a gland in another human thinking it's for the health of that person is smoking something really bad in the back room. If you have thyroid and parathyroid weakness, where you're having the colder body, the slower heart rate, and you're not utilizing calcium properly, you see the veins and the hemorrhoids and the cramping and maybe the bruising easy, that's your parathyroid, and you see ovarian problems or male problems, you start to see too many endocrine gland problems, you can really suspect the pituitary, and this would be especially true if you didn't have any tonsils. This is a thyroid nodule, which is common. benign thyroid nodule. Doesn't matter if it's benign or cancerous. If it's cancerous, it only means that those acids have been breaking down the cells. And that, of course, then makes it a cancer, because cancer is just a word for damaged cells. It's what damages the cells that's essential to understand and go after. And of course, that's your lymphatic system that deals, your sewer system that deals with the acids from the cells. Consider a thyroid nodule no different than a nodule in the colon or anywhere else. When you start to see swelling anywhere, or a pimple, or a boil, or a cyst, or a tumor, you know there's a blockage. When there's a blockage to the flow of a fluid, the fluid backs up, right? Just like a lake, a stream going down a mountain, and you got beavers building dams all the time, the water backs up and overflows the banks, right? Well, the same thing happens when the kidneys lose their ability to filter. And sometimes it's over years and slow, and other times the genetics are so bad, I wonder if kids come in not even filtering. Look at the young babies with tumors. Your mother wasn't filtering. And when the mother isn't filtering lymphatically, guess what? Neither's the infant. You might want to have your girlfriend listen to this video because she needs to deal with this now. Cutting out your thyroid is stupid and crazy, because now you'll have symptoms. They'll put you on some synthetic T3 like Synthroid or levothyroxine, and your life will be hell. Forget the calcitonin in there, and if they remove part of the parathyroid glands, forget your bones, forget your happiness, forget that. And you want to deal with this now, because you have to address why the nodule. And it's up here this high, meaning the whole head can be involved. And it just shows kidney and adrenals are down and not filtering. And so you want to clean up the bowels, get the kidneys and adrenals filtering. Yes, sweetheart, the diet's going to be strict. Watermelon fast, grape fast, it doesn't matter. So getting a nodule out is no different than getting any other tumor out. It requires fruits, berries, and melons because they're astringent in nature. It requires you to get into the adrenal glands. Chances are, if you're young guys, you got low blood pressure too. So you want to go into those adrenals, get the kidneys filtering. So we do adrenal glands. Sometimes we do the glandular because of chronic. And if this is a young gal, she probably has chronic adrenals at her age. But the other side of that whip is the lymphatic system, and that's the sewer system of the human body. That's where all the cancers are, except for a few true leukemias. Even half the leukemias are lymphomas, so at least created. So this is why that system is so very, very important to get onto. And don't get overhyped up about some nodules in the thyroid. Just get your focus. She has to learn what the lymph is, and that if she doesn't get this now, she can pop tumors in her brain or other places. This isn't just about the thyroid, believe it or not. This is a systemic problem. There's another one, hypothyroid. Can you talk about if there is anything that can cure hypothyroid, or do I need to live with it forever? I take a pill every day. And this is Madeline. Madeline, we've discussed that quite a bit. But let me say this. You know how you get your sinuses full of mucus when you drink dairy products or eat dairy products and stuff like that, and you get a lot of mucus in your throat and voice box and lungs? Well, the thyroid and parathyroid glands also become full of mucus and lymphatic stagnation when the lymph isn't moving well through these tissues. Then that sets up inflammation within these tissues, and it can create either hyper or hypothyroidism. Hypo is always where you're going to go. You're always going to go to a hypo state as you move your tissues toward death. So the best way to correct this sort of thing is detoxification. If your cells of the thyroid are working on genetic memories and they're not performing like they should, then you want to use a glandular. But you also have to determine if this is a pituitary problem as opposed to a thyroid problem. I find that mistake is often made, that we blame the thyroid for the problems when in fact the pituitary is suppressing it with low TSH. We have to trace why thyroids become weak. What system can we trace this through? The blood? No, the lymph. Blood never suppresses anything unless I reduce or close off the supply. We call that ischemia. When blood is not getting to tissue properly, we call that ischemic changes or ischemia, meaning there's a reduced blood flow. That can be generally from occlusions, and occlusions are blockages. 99.999% of all blockages are lymphatic blockages, not blood blockages. Blood clots are factors, no question, but that's when we start eating proteins and monkeying with our diets and getting away with proper nutrition. Proper nutrition is always carbohydrates. Proper nutrition is always fruits, berries, melons, and vegetables. And if you really want to focus in on truth, vegetables are not our foods unless we go to the veggie fruits, like the cucumbers and things like that. But when you get into the lettuces and things like this, we're into a food that's very difficult to digest. And again, if you want to detoxify, you don't want to be consuming those foods. Reduced thyroid, and we just talked about thyroid. Whenever you see a reduced function of a cell, and you see that happening more and more as you're getting older, then what's happening in your body as you get older? You're losing more lymph drainage. And one of the things you see a lot, of course, is what? Thyroid polyps. You know, nodules in the thyroid. These are little tumors. Just like polyps hanging from the colon. These are little tumors. Where they're coming from? They're coming from the interstitial levels, and this is in and around the cells that make up the thyroid or the bowel or wherever. This is the lymph system not going anywhere fast, and that's what you don't want because it is suppressive, but being acidic is damaging in time. Till then you get a swelling or a goiter or suppression of the thyroid, or it can create hyperactivity as well. All these people where all these docs recommended, even naturopaths recommend iodine. Oh, really? Yeah, that's the quickest way to get hyperthyroid there is. Taking iodine by itself is a very dangerous practice and not one highly recommended. Better to take kelp. Then you have radiation protection, you have everything else. But to use iodine by itself, not good. And then remember, the lymph has to clean. So some of these things, we see all these red iodine spots in people's eyes all the time because they're not metabolizing it. A good example is a medical doctor called me kind of yelling at me about putting his patient on thyroid. And I said, well, who's your patient? And so we looked her up here, and here she had a list this long about the thyroid gland, and definitely her basals were low, she was cold, you know, all these symptoms. And he was ranting and raving, why was I doing that? And I said, well, take a look at these symptoms. And he said, and I said, aren't these symptoms of thyroid? He said, well, yes, but her blood work shows there's no problem. And I said, well, why don't you quit treating her blood work and treat your patient? The problem with that, he hung up on me, but the problem with that is, how would you treat your patient? Yes, with synthroid or something thereof, T4. If you're smarter, you might go to T3, which is armor, but both of them make the thyroid weaker. And what about calcitonin? There's a calcitonin hormone in there. And what about the parathyroid? So there's no, and then a lot of medical doctors give synthroid for TSH problems, and hear people on thyroid medications and they see no improvement. I hear this a lot. They see no improvement on thyroid medication because it's T4. Their problem is TSH, and their problem is in the pituitary, not in the thyroid gland. And so they're treating the thyroid with T4, and the problem isn't there, so the patient doesn't feel any different. And so that's the kind of ridiculousness that's out there, you know. Determination of markings in the eye is not going to tell you hyper or hypothyroid. I'm sorry. You can really see that in your symptomology. That's for sure. Hyperthyroid yields a higher fast rate, yields higher body temperatures, that sort of thing. Jitteriness, that can also be hyperadrenals. Hyperthyroid, generally, if you have a stagnant lymph, you start getting goiters, things like that can happen from that. Yeah, if your thyroid is enlarged, you might be able to get away with a little kelp, but boy, I would keep that minimal, and I would really detox until that swelling is all gone. That's all lymph. Get that moving. Now clean your GI tract real aggressively here. Clean up your gut. Get your kidneys and adrenals on. That'll come down, and once that's down, probably will be in a hypo state. All right, then we can kick it up and move it on. Acidosis can be hyper-hypo. Acids can stimulate or deteriorate. In the long run, always deterioration. Always hypo death is the end result of acidosis. In the earlier stages of pHs, though, you can see hyperactivity with those. So the thyroid does affect heart rate. So you're definitely going to work on the thyroid and the health of the thyroid. But when you go and look and say thyroid, you also have the parathyroids. And calcium is a vital constituent to nerve health. So, and not only connective tissue, but bone. People have mitral valve prolapses or heart murmurs, have weak valves. This is calcium utilization problems. The same with connective tissue. So if you look at this, the simplicity of this is you're going after all the cells of the human body and making them healthy. Because if you wander too far from that, you're separating from that and going like medical doctors to individual symptoms, and you're getting confused because now it takes you away from the whole. You must incorporate the whole when you look at the part. You always have to do that. And when you do that, you're always successful because you always have to detoxify. That's why it's the golden key. Remember, the end result of detoxification is regeneration of tissue. Well, what strengthens the thyroid is really getting rid of what's weakening it first. Get your lymph moving. With all the blood and all the goodies, that'll strengthen everything nice on a raw food diet. But it's getting rid of that which is breaking or stimulating it. And that's going to always be the lymph system, even if it is a pituitary problem. Now, it is true that the colon could have some problems, high impactions in areas that could have a nerve reflex to the thyroid and actually hyperstimulate the thyroid from the bowels. So that's why we always clean up the GI tract. Remember, I'm always talking about the GI tract as an electronic panel that controls everything too. Everything is just so interconnected that we have to always move holistically toward the world of well-being. Just diagnosed with 2 thyroid nodules and 1 is cancerous. So really doesn't want to get her thyroid removed. Boy, I wouldn't, but she doesn't know what to do. What can I tell her if she chooses your program? What would the herbal protocol be? And would she want to avoid glandulars at first? Thanks for your help. Much love to you. Much love to you. You know, I tell you right off, I would drop a 40-day grape fast. You know, it seems like a long time, but I tell you, it isn't really. When you put your head into it, it's this food you're eating. I'd carry grapes around with me constantly and eat constantly, and I would hit on an extended grape fast at the same time. I'm going 2 kidney formulas. I'm doing 2 lymphatic formulas. I'm cleaning up the GI broom. I'm using a stomach and bowel. I'm using GI broom. I'm going to start pulling and opening and cleaning. I'm going to sweat. I wouldn't touch the thyroid with any glandulars for the thyroid, but I would touch the adrenal glands with an adrenal one. I wouldn't touch the thyroid with anything because increasing the production of the cells of the thyroid will increase the size of the polyps. You know, it's just acids in there. And just detox, You really want to move this out through the lymphatic system. You have to do it anyway. She's going to back up and have a future brain cancer. So removing the thyroid is not the answer, and she's not going to like how she feels. You want to get those kidneys filtering. You want to get her up on a little bit of a fast right now. Even if it was, start with an all raw food diet for a week, then jump to an all fruit diet for another week, then jump to a 20, 30, 40-day grape fast, come off of that, balance out for a week, hit a 10-day lemon juice fast, really pull that baby out. That's how you get this one.
If you have cancer, you got to go.
You got to go. You got to move lymph. Don't play the games. Don't play around with vegetables. Move yourself up into these higher astringents, right? This is, I was on my girlfriend's mom just had some surgery done on the thyroid and had radiation done after the surgery. My God, are these guys. You know, this is so disturbing and unbalancing to me. It's hard for me not to have deep compassion for your mom. She should have grabbed and said, no way. Now she's radiating like a Christmas tree and nobody can get around her. And like they told her, they said you can't get around her son because she could make him impotent. But radiation doesn't spread, does it? I remember that pinpoint radiation, right? What are these guys? Where are they coming from? And the other question, which I think is good, what you said, is when my thyroid is back to normal, do I continue the formulas for life? Heck no. I mean, this is about getting things healthy and letting them be healthy. You know, in a healthy state, how many animals do you see carrying around supplements? what I would do if it was me. I can't tell you about your pharmaceuticals, not my field, obviously. By law, it'd be, but if it was me, certainly if I'm taking a glandular that's making my thyroid tissues work better, and my thyroid as a whole is working so much better, and I'm producing plenty of T4 and calcitonin, I'm going to find that my synthetic T4, levothyroxine or synthroid or whatever, even Armour, I'm going to find that that's going to be too much for me, and my heart will probably start racing if I'm taking too much of something for the thyroid gland. So maybe I need to cut down on the stuff I know is weakening my thyroid, and it's not really making my thyroid work better, which wouldn't be the glandular. And so then I would be titrating. I'd be coming off of that crap, and I'd be taking the glandular to replace it. And then after I feel pretty good, I'm detoxing, I'm cleaning myself up, building myself up, I would come off the glandular the same way. I'd come off every other day. How's my basal temperatures under my arms? Do I feel good? Do I have energy? Do I feel cold? No, I feel nice and warm. Good. Then you're done. You don't have to take any of them anymore. Isn't that cool? See, so you want to use a glandular to get off of any synthetic crap. Who would want you to stay on, even the FDA, who would want you to stay on something that weakens you and that in the long run has dangerous effects? I can't imagine that. I have complete adrenal exhaustion and underactive thyroid from my hair analysis. It was recommended that I eat protein meat with supplements, minerals, and to stay away from fruits and veggies. I'm a bit confused. Well, don't be confused. Who's confused is the labs. This is why I don't do a lot of hair analysis. It doesn't matter to me what someone else says. And this is what I want to get you guys so knowledged up and experienced. There's nothing like experience. When you have experience, no one can take that away from you. When you know truth, no one. That you've got it. But they have different biochemists, and they have different concepts of health. Medical has protein concepts and ridiculous stuff like this. So if you're getting a hair analysis, I don't even look at the mineral ratios. Who cares? They're going to come into balance no matter what you do. You can't balance them out by taking supplements. That's what hair analysis is involved around, is supplementation, chemical homeostasis. That's not why you do a hair analysis. You do a hair analysis to look at your toxic elements. Your toxic metals like mercury, cadmium, lead, and just to give you a look. But how do you get them out of you? Well, you can do chelation, but I don't like that. I like true chelation is detoxification. You can't beat it, and it's head to toe. So I really like that. Plus, you regenerate tissue at the same time. But don't listen to what the friggin' lab says. You know the truth about the diet. Hypothyroidism is at the top of the list. At the cold hands and feet, low body temp, hair loss. Now, again, I really feel that thyroid has nothing to do with hair loss, although you see it in hypothyroid cases, but I think that's also when you see chronic lymphatic problems in the head area. It's acids that are going to take off the hair. I mean, every time I talk to you guys that have done the chemo routes, hair loss has been a part of that, and so it should be in your face or on your head that acids are at the core issue of why you break down tissue. She's a 41-year-old female, and in the past have been diagnosed with hypothyroid and endometriosis. Well, immediately when you're into endometriosis, immediately your kidneys and adrenals are involved. Immediately you're not moving lymph well. You probably don't realize it, but you're probably having ovarian cysts coming and going by this time. And this then another thing that you see along with this for females is fibrocystic breasts. Well, this is all about a systemic problem. Remember, lymph is a systemic fluid, therefore it becomes a systemic problem when you're not filtering and moving these acids out of the body well. And that's what we've been facing, a systemic problem. This isn't a local problem, and I think a lot of times in a lot of the other modalities we get used to treating symptoms and not realizing that the systemicness of the issue. It is always a divine pleasure, and I'm honored always to be here to help you. Have a fun day. Bye-bye.